Okay, new drugs. New drugs are coming. There are new drugs coming for obesity. There are 2 or 3 that are on their way to being approved, and I'll talk about them in a minute. The older drugs, of course, that we all know are the phenteramine, which is a kind of an amphetamine type drug. The Subutramine, which is a somewhat similar, and it causes about 5 to 15 pounds of weight loss if you take it for a year. Costs about $1,000, and after the second year, so it causes some high blood pressure. But it's approved. We have access to the other drug, which you can buy over the counter, called Ally, which is Orlistat, also called Xenical. And again, take it every day for a year. 5 to 15 pound weight loss at the end of the second year. 5 pound weight loss, maybe 10 pound weight loss total. But those are approved. Now, apropos your questions about smoking dope. It turns out that the chemical that makes marijuana a psychoactive drug is tetrahydrocannabinol. And the reason I knew that is purely for research purposes. It turns out, now I don't know this personally, but I have heard that when you smoke marijuana, people get what are called the munchies. They want to eat. So researchers gave rats marijuana, and they found they ate a lot. So they found a chemical, a drug, that blocked the marijuana receptor in the brain. And the mice lost weight. They also taught the mice to smoke, and they quit smoking. So they spent 10 years, millions of dollars, and they got this drug called Rimobant, also called Accompli, A-C-C-O-M-P-L-I, approved in Europe. And it decreased blood pressure, it increased blood pressure, but decreased cholesterol, decreased weight, and it was approved in England and Europe, and they have taken it off the market there because it was associated with increased risk of suicide. Because when the mice didn't have their munchie receptor working, they were not happy. And so they got depressed and they had high incidence. So that company and several other companies which were working on anti-tetrahydrocannabinol receptors for weight loss have stopped all their research. Now there are some new drugs coming out. There's one that's a combination of Toprimate, which is an anti-seizure drug, and the amphetamine, phenteramine. And it does cause some weight loss, and it's coming. It'll probably be approved. And there are 2 other combination drugs like that that are due out, which may work. We're talking 10 to 20 pound weight loss over a year, but they may have some things. Hey Trouble!
Oh,
so that's the latest. That's the latest on drugs.
Hi.
Hi, how are you?